I appreciate it. I'm going to go ahead and share my screen if that's okay. Alrighty. All right. I always hate asking this, but can everyone see that?
Yes.
Good.
You're
okay,
good to go.
All right. So good afternoon, everyone. I'm so excited to be here at this meeting. Obviously, as we've all expressed, we wish it was in person, but this will be a good 2 days and a good hour for this town hall. So as I said earlier in my introduction, my name is Crystal Barter. For those of you that I haven't had a chance to meet yet, I am the Director of Performance Improvement at the Michigan Center for Rural Health, so the Michigan State Office of Rural Health. But I'm also the 2021 NOSORH Board President. I will say that we all express sentiments about wanting to be together in person, and we are so excited about that. I do want to give a shout out though to the NOSORH team because I really think that they do not miss a beat in making these virtual meetings very impactful, informative, and engaging. So kudos to the entire NOSORH team as we've all transitioned to this virtual world. And I have no doubt that the next 2 days will be no exception to that. So kudos, NOSORH. Today, though, for around the next 35 minutes or so, we'll be continuing the theme of our town halls for this portion of the agenda. I hope that most of you were able to join us for the first NOSORH town hall this past winter. It really was an engaging discussion that allowed for direct feedback and insight from members into the NOSORH strategy map. So I will pull that up right here. We'll continue that town hall feel today with some very specific topics. Those include diversity and inclusion, broadband, emergency response, and rural stakeholders. So Terrell did give us a sneak peek of what we'll be discussing in the chat, so feel free to pull that up as well. We'll then move into our more business type things with regional rep elections. And then we'll have our friends from the Federal Office of Rural Health Policy facilitate a discussion as well. So hopefully this image that you see on your screen is not new to you. You are looking at the NOSORH strategic plan or strategy map, where we have as a board and as an organization have specific goals around 4 themes. One is cultivating a vital rural health landscape and infrastructure, growing leadership to address rural population health and health equity. We'll be definitely discussing that today. Building capacity for rural data-driven decision-making, and then advocating for meaningful partnership for additional resources for SOARs and their stakeholders. We've seen some success in that over the last few years. Did want to give a huge shout out and thank you to Graham Adams, who leads the futuring work for the NOSORH board and was such an integral part in shaping up this strategy. So kudos to Graham. A few items of note for 2021, just want to make sure everyone's aware. The NOSORH board did add a specific role that would really focus on the diversity and inclusion efforts to really help NOSORH from a governance perspective. So making sure that our policies and procedures and some of our governance protocols are aligned with diversity and inclusion efforts, and also from an educational strategy perspective in terms of the work that you guys are all doing in your communities around diversity and inclusion. Looking forward to that conversation today. Corey Kaiser does lead that effort on the NOSORH Board of Directors. Also wanted to note that we have a specific role on the board for stakeholders. So Ernie Scott is leading the work with the NOSORH board on which stakeholders NOSORH should really engage in a meaningful way. I think most of you on the call were probably involved, pretty heavily in the CDC health disparities funding that was just submitted. And I think that's a really good prime example of how NOSORH and then state offices of rural health, when relationships are built very strategically, with certain key stakeholders, they can have a large positive impact. So that's just one example, and we'll discuss more today that you're seeing and you're building within your own states. So with that, before we get into the discussion points, is there anything Terrell, Graham, or NOSORH staff that you want to add?
No, well said.
All right. All right, well, hearing none, we will move right into our discussion points. So as you see, our discussion points are around, as I noted earlier, diversity and inclusion, rural broadband, emergency response, and rural stakeholders. And we'll have about 5 to 7 minutes for each of these. So not a ton of time, but we really hope that it's an engaging conversation. And Terrell and the team were nice enough to give us a visual depiction of how these particular topical areas align with the NOSORH strategy. So you can see our diversity and inclusion conversation aligns directly with our efforts to grow leadership to address rural population health and health equity. So with that, let's open it up. Diversity and inclusion is very, very large and complex topic, but we also know it's just an incredibly important topic, and more state offices of rural health are really focusing on this. So with that, what resources does your SOAR use and or need to promote diversity and inclusion in rural communities? And we are just
And I would just remind folks, if you want to, I was just going to remind folks, if you want to raise your virtual hand or do that, and we can call on you that way. So.
And the first one who speaks up does get a prize. I will mail you a prize.
Just chime in here just
Crystal.
for yep,
yeah. Go ahead, Graham or Terrell.
Go ahead, Terrell.
I was just going to say that, you know, we know that we hope that you all have some kinds of policies related to diversity and inclusion. We see that as a backbone to some of our work, certainly around population health and health equity. The board's undergone some training that's been so informative to us, and we really have wondered, you know, how we'll take this apart by governance structure and also by resources for state offices. So we think that it's very, it provides a backbone and a framework for your work around health equity too. So if you don't have a framework around that, we'd love to know and to hear what else. Sorry, Graham, I didn't want to stop you from chiming in.
No, that's fine. I'll offer one thing, and then maybe I'll ask Andrew on my team to talk a little bit about the training that some of our staff has gone through. I believe it's called results-based accountability. But so I think every state health department has been applying for a CDC grant to look at disparities caused or exacerbated through COVID, and that's a pretty big chunk of change. That should be coming into your state. Those grants start, I believe, June 1st. So if you don't know much about those grants, you may want to reach out and find out. Rural was a priority focus, and I think had a set aside within your state grant specifically for rural. So hopefully you know all about it and have been engaged. But that could be a tool for you to potentially access some funds, but definitely be part of the conversation as they're going about trying to identify and address disparities. Again, disparities we all know have been around way before COVID, but COVID really kind of peeled back the onion, if you will. And unless there are questions about that, I would ask Andrew on my team to talk a little bit about that training that some of our folks went through.
Just giving a pause to see if there might be any questions, but sure. Yeah, so I don't necessarily know of a direct need, but as Graham alluded to, I can certainly talk a little bit about some of the things that we've done in South Carolina through our community health transformation work. And a lot of that is grounded in coalition development and working with rural grassroots leaders and stakeholders and varying capacities and varying agencies and sectors to think more broadly about health. And so we've done two things. Is one, we contracted with some content experts in DEI, diversity, equity, inclusion, and hosted a peace training series. And it's an acronym for promoting equity among communities effectively. And so we provided a series trainings, I think it was like 4 or 5 different series of trainings to go from the very basic level of DEI into kind of how do we incorporate that, the health equity lens and the different things that means into our community work. And so that was very helpful. We left them with different toolkits, conversation starters, to kind of help them gauge their capacity. Are we asking our residents what they want? Are we listening to our residents? You know, is it all in the county seat? Are we looking at the different pieces of rural, you know, outside of just you know, the most populated areas? And then the other thing that Graham mentioned is we've also contracted with Race for Equity, which is based out of North Carolina, and utilizing the results-based accountability evaluation framework and utilizing equity through that and helping them think through their action plans as they write out their outcomes or their results or their strategic plans or whatever, and making equity as at the forefront of that. And similar kind of to the Peace Training Series, we're building off of both of those to help make sure that they not only get educated and raise awareness, but then also we help them with implementation of those strategies. And through some of that also, we've been able to provide additional technical assistance by reviewing, say, bylaws or process and procedures specifically around membership engagement for their coalitions as they continue to develop.
Thank you, Andrew and Graham. That's great. Anyone have questions for Andrew or Graham, or is anyone willing to share what they're doing in their state, if anything, around diversity and inclusion?
Hey, this is Caroline Collier from North Carolina. I wanted to share that our office has started a Diversity, Equity, and Inclusion Council, and I think a few other members are on the call today. It's pretty new, but we're looking into a lot of different things. We've started a resource catalog, as well as we're looking into how to look at some metrics that relate to diversity, equity, inclusion for our grantees, and as well as at our office level.
Thank you, Carolyn. I think it'd be really great if you could keep us apprised, you know, as the council moves forth, especially around the metrics for the grantees in your office. I think that's something that, you know, with this particular topic, it's nice to have a measure around. So thank you. Others?
Hey, this is Stephanie Nance, also from North Carolina. Our department has organized historically marginalized populations work streams to, in response to COVID, that we anticipate will continue on, but it was to work on strategies around prevention, testing, tracing, vaccine uptake, and issues around social determinants of health around historically marginalized populations. And also the department stood up a community health worker initiative, and a large part of that was to work on diversity and inclusion by ensuring that historically marginalized populations had access to care and support.
Wonderful, thanks, Stephanie. And was that a part of the CDC Health Disparities funding, or was that prior to that work?
That was prior to the work. The work streams formulated early on during COVID, and they've gone through some updates as our department's response has emerged. But they've been going on since COVID started, and they include both members of Department of Health and Human Services, but also external members.
Wonderful, thank you. Any other states willing to share? Alrighty, well, this will not be the last time that we obviously want to gain member feedback and insight on this very important topic. But if anything does come up post this meeting, you know, feel free to email Terrell or myself or Corey Kaiser, who is the Health Equity Liaison on the NOSORH board. So thank you. We will move on to our next topic. And this is one that, in addition to health disparities, which has always been an incredibly pressing issue, but has kind of rose to the forefront with COVID. I would say the same as broadband, right? It's always been an issue in our rural areas. COVID exacerbated that as everyone had to move to this virtual world. So what are you doing in your states in terms of rural broadband? And this is a broader question, but, you know, do you have any challenges? Obviously there's challenges. Do you have any wins in addressing rural broadband? And then, you know, are there specific interests in rural broadband that your SOAR is pursuing or would like to pursue? And we'll open it up.
Hey, this is Shannon with South Carolina. I would say that, you know, there are several broadband bills out there right now. There's about 3 of them at the federal level. So it's going to be interesting to see how those go through. Again, not just 1, but 3. You know, in our state, we're lucky to have an organization that we work with on a daily basis called Palmetto Care Connections, who works on a lot of the broadband. And then also through our Rural Health Action Plan, we do steps to address rural broadband across our state as well.
I love that it's included in the Rural Health Action Plan, Shannon. That's really great. Other states?
Hi, this is Rachel.
Hey, Rachel.
I'll just be going more so like the challenges, I guess, / interests. Challenges have been really just figuring out what available resources that just would make sense and that can be utilized by, you know, the certain stakeholders and facilities in the rural communities, you know, to essentially help them with broadband, maybe increasing our expertise and knowledge on how to facilitate that, whether it's certain equipment they should buy or, you know, certain tools they should use, software programs, stuff like that. If there was almost like a, like a package to just kind of present to them, because what ends up happening is you get all these various vendors that get in their ears and then they think they need to buy this $10,000 piece of equipment or a computer or this software program that's so confusing and that's not user friendly. Only one person has the time and the capacity to learn it, but then that person leaves and then they don't use it, so they go back to their old system. So yeah, those have been kind of the challenges, because we are trying to, in our office, kind of enhance how we engage when it comes to whether it's facilitating funding for some of our sub-grantees or how we process any kind of data or paperwork or any kind of correspondence more in a digital way. But that has been kind of difficult just because they might not necessarily have the most updated computer or not as experienced with certain software, whether it's like SurveyMonkey or, you know, some type of Microsoft new app or program. So those have been kind of the challenges, and, you know, we definitely would be interested as far as just if there is a kind of like a package or just guidance in the sense of like, here's just the basic, easily 1, 2, 3 steps. This is all you need. If you only have this particular type of laptop, you're able to download these kind of software programs, and these programs will help with XYZ within your facility, stuff like that. I think being able to provide that level of technical assistance, I would be very interested in for my office.
Thanks so much, Rachel. Yeah, I think that package idea sounds amazing, and I'm not sure if you know, that's something that the NOSORH staff could potentially assist with in terms of curating. Your comment about, you know, just bringing you know, the level of expertise in-house for your SOAR resonated with me. You know, I think in healthcare, we have our own acronyms and language. And then in this world, in broadband, internet, et cetera, there's a whole other language that we have to learn, a whole other set of acronyms. So there is a steep learning curve there, I think, you know, for offices, but then also for individuals in our rural communities. So thank you for sharing that. Other states?
Crystal, Sebastian has his hand up.
Oh, thank you, Matt. Yeah, and Matt, if you could help me with the raise hand function of folks, that'd be great.
Yep, I'm on it.
Sebastian?
Yes, yeah, this is Sebastian from North Carolina. I just want to say really quick that our office, for the last 2 years, we were working a feasibility study with the ARC, that is the Appalachian Regional Commission. And so we were granted with that feasibility study, and right now we are in the implementation part of the grant. So that is basically for extend broadband in rural areas, and especially in our particular case for telehealth. So this grant will help to give us the funds for provide with patients with RPM for homes, remote
patient monitoring.
Yeah, and also education funds for technology education for the patients and for providers. And this is pretty much for the west part of the state. So we're very excited in this part of the implementation grant. Thank you.
Thanks, Sebastian. And what was the name of that grant again?
Yeah, the ARC, Appalachian Regional Commission.
Thank you.
Yeah.
Wonderful. Any other comments on this topic? Obviously, it's a big one, but I know that more and more states are starting to work in this space because it does have a significant impact on health outcomes, but also, you know, the economy in our rural communities.
Carl? Oh.
Carol, did you
go ahead?
Okay. No, so one of the things you listed as wins. So for Alabama, Governor Kay Ivey just signed a $17.5 million initiative to expand some broadband resources within our state, which are should affect around 12 different rural communities. We work really closely with our Office of Telehealth, also located within the Department of Public Health, where our office is housed. And I think one of the challenges that we have run into as a state is having a lot of the small local broadband providers not wanting to put out infrastructure that won't be financially sustainable once the money that's coming through in this wave and possibly the next waves that Shannon spoke of will sustain to keep that infrastructure in place. But we're happy in Alabama because we are, you know, we're getting some more communities connected, and that's always a win.
That's awesome. Thanks for sharing, Carl. It looks like Graham and Andrew might have their hands up from South Carolina.
Yeah, I'll just add real quick. Through the rescue plan, there's about $360 billion that will be coming to states to address a variety of needs. But as Crystal spoke of, broadband's really become, you know, more generally recognized as a challenge especially for rural communities. So in our state, the last two different pots of money that have come through COVID, pretty big portion of that has been used for broadband, and I anticipate the same will happen with the $2 billion that South Carolina gets. So your state should be getting quite a big chunk of change. Again, one would think that it's very likely that some of those dollars may be going to broadband or to interconnectedness efforts. So trying to find out more about that would be helpful, I think, for folks.
Thanks, Graham. Andrew?
Yeah, I was just going to expand a little bit off of what Shannon mentioned earlier, and just our office has continued to kind of help engage and stay abreast of different things related to rural broadband in South Carolina, whether it's through mapping or some other legislative type of actions. But I will mention that we do have a colleague at our office that has specifically looked into some things, digital economy ecosystems and the connectivity of rural communities. We've done some pilots in different parts of the state, and essentially helping them think about broadband and the economy and how digital and this virtual world that we've been in for the past year and a half can certainly have an impact on bringing jobs and boosting the local economy. So that's been some wins, and there's some other things that we've achieved through our office there. So I just wanted to expand a little bit further on some of the activities that we've experienced here in South Carolina.
Thank you so much, Andrew. Any questions or comments for the states that just recently spoke? Any additional comments on broadband? NOSORH team, it sounds like we have a few states that are kind of front runners in this space that we can continue to lean on for resources and expertise as we all move into this world. Thank you. So we will move on to our next topic, another fairly broad one, but I do think that state offices of rural health across the country have developed different relationships with the various emergency response infrastructures within their respective states. You know, in Michigan, we definitely have. So we wanted to build some time on the agenda today just to get a sense for Region B, you know, how is your SOAR partnering with emergency response stakeholders? Whether that's within the state government, whether that's more local stakeholders, would like to get a sense from SOARs on how you are partnering with these stakeholders. So we will open this up as well.
I think it's okay to say we're not, if that's the case. So we'd, be interested to know that too.
And I know a lot of the states in Region B are embedded within the state health department. So there might have already been a connection there in terms of the state health department infrastructure or the state infrastructure for emergency response. But even if that relationship has, evolved or intensified, that would be good to know as well.
Can we call on people?
We totally can, Terrell, and you have some more nuanced insight and intel into what states are doing. So I would lean on you to assist with that.
Oh, not at all, really. I mean, I've had some experience working with county managers and county EMS response managers who have that response for emergency response. Part of the reason why the board had this discussion and is that, we certainly learned that we were not prepared for a public health emergency. And a lot of times this work is about a local response. And we certainly know that local emergency response planners are strapped. They might have 5 other hats to wear in their community. And so we have thought about the importance of, while being impactful to those and giving the state offices some opportunity to interact well, but also being a part of the national conversation about how we prepare for the next rural one. But I was gonna try to, she might not like it. Nita, I know you said that I don't think you used the word introvert, but I kind of think about you more for EMS than for emergency response, but I know that you live in that world a bit. And if you're there and willing, I'd love to hear any insight that your years of experience with EMS might give insight about emergency response and anything like that. Certainly EMS can be part of the emergency response, but there's more to it than that. Would you like to share anything about history or experience in Georgia, or maybe the lack of a connection even, if you're there, Nita?
Our Office of EMS obviously works really closely with the emergency response folks in the state, and they're sort of in the same office. So there is a lot of initiatives to prepare for emergency response as a whole, either in counties, in regions, or across the state. The pandemic obviously shined a light on some of those areas that were not well prepared. You know, evacuations and disasters and large scale events like that. I think the state and the EMS, the emergency response, emergency management agency, and EMS folks in the state were well prepared, but certainly they have seen some new needs that have arose from the pandemic. They've also seen some other ways that emergency medical personnel could be of value, not just in the initial beginning of the event, but in these long-term sustained sort of events. So I think on the other side of the pandemic, we're going to be able to see exactly what those new areas that EMS addressed during the pandemic what areas may be sustained moving forward. And certainly, you know, just like every state, we have a big difference in the capacity for EMS to participate in something like this in urban areas versus rural. Rural gets taxed in every way, as you know, immediately, where the urban areas, because of a lot more resources, you know, don't run out of fuel quite so quickly. So I think the ability for a backup plan, or the need for a backup plan is evident right now in the rural areas, looking at this pandemic specific to the kind of emergency responses we've been used to. I hope that was helpful, Terrell. I know
thank you.
Mattered, but
hey there, can you hear me okay? This is Bruce Evans from the National Association of EMTs.
Great.
Can you hear
Bruce,
me all right?
Yep, Bruce, we can hear you.
Yep, we can hear you.
Okay. Yeah, I'm sorry my camera's not working, and I just appreciate being here. And I would just give you a little a snapshot of, and I know we're talking about this tomorrow, myself and Matt Zavatsky. But so I'm a fire chief in a super rural environment, 12,000 people and 264 square miles of Southwest Colorado. I would tell you that our participation years ahead of time in the healthcare coalitions with our local health department, which is the San Juan Basin Health District and Health Department, it's laid the groundwork for many, many advances that we were able to put in a rural environment. I would tell you that we were, as a small fire department with only 30 people, 8 folks on duty every day, covering that kind of terrain. We began vaccinating the public on January 10th as a 1A vaccinator. And I would tell you that all of those advances and being able to offer those services in a rural environment was because of relationships that were built with the health district through the Healthcare Coalition. So we had obtained a used vaccine fridge from them years before the COVID made its debut. Our relationship and trust that was built between the health department and the fire district, and just knowing people face to face. You know, we always like to say in a wildland fire situation, it's good to know your neighbors long before the emergency. And that held true in the pandemic also. Like other folks around the country, you know, funding was a big deal because the public became generally scared to call 911 and go to the emergency room. So even if they were having a heart attack or a stroke, they were fearful of contracting COVID in the emergency room. So a lot of the call volumes for rural agencies that sustain them financially deteriorated and put a lot of rural agencies in financial problems. Now there was, I think the other thing that was probably key is that we wound up with extra resources. So because we vaccinated our population very early, we had the expertise amongst our firefighters and EMTs to do intramuscular injections, which I think sometimes other health departments don't understand what EMS really does. And we were a force multiplier for the health districts or the health department's other equity initiatives and equity clinics. And I would also say we were key in getting over vaccine hesitancy, because we were able to, it was the fire department that was administering the vaccines, and some of the kind of grumpy old ranchers that we have in our district who were vaccine hesitant or anti-vaxxers, we were able to overcome that. But as a small rural agency, I sent folks to Memphis. I sent folks to Edison, New Jersey as part of the FEMA contract with the National Ambulance Strike Teams and fixed site personnel. Sent 4 rotations to Edison, New Jersey for vaccine clinics there. 2 groups of firefighters to Memphis to help with their vaccine clinics there, and then also a deployment into Del Rio, Texas. So as rural agencies and mainly as a tourist population, our call volume is really down in the winter and on the shoulder seasons here in Southwest Colorado. So I had staff that was willing to go and willing to send. So unlike many situations where the resources are coming from the metro to the rural, in this particular case, I think the rurals had resources to send to the metros. And all, again, just part of the snapshot of what happened in rural Colorado here. Thank you.
Thanks so much, Bruce. That was really insightful. You know, I think in all of our states, we've always known the value that rural emergency medical services provides. And then with COVID, hopefully more and more stakeholders really understand the profession and the incredible value that they provide to their communities. We definitely saw that in Michigan, the profession being recognized by more and more stakeholders. So that's amazing. Thank you. So we are running a little short on time. So if you do have any specific examples that you want to share with NOSORH board, the staff, on how your particular state is partnering with emergency medical services or more of that emergency response infrastructure in your state, please put those in the chat or send them via email. And we will quickly review our last kind of discussion point. So as I noted, as part of the strategy map, really taking a step back and assessing which more national stakeholders NOSORH board should be working to engage and build meaningful relationships with is something we're prioritizing this year. Ernie Scott is leading a task force around that. They've had a few meetings. If you're interested in being on that task force, put your name in the chat and we'd love to have you. But one thing they wanted to garner insight from on the region meetings was whether at the local level or at the national level, what new kind of stakeholder groups have become increasingly important to your state Office of Rural Health? And then are there any that you view as really important, but you're finding challenging to engage? Stakeholders is a very broad term. So feel free to, there's no wrong answer here. We'd love to just kind of hear what comes to mind when you think of these two questions.
Chime in just kind of quickly. One of the things that we know is that, and that you've seen us do over the last year, especially, is try to come alongside state offices of rural health, and that's never been more successful than when we had the help of the Michigan office, South Carolina office, and Colorado office on the TIN reporting for RHC. But we want to be able to help you identify those and work with the stakeholders in your state, like the local broadband providers, and then we can connect with NTCA. So I happened to have a call with right before this call saying, gee, my rural broadband providers want to connect and understand rural health better. So if you know of stakeholders that are within your state or around your state or in different regions, and you see that difficulty in connecting, I think that, we're very interested to hear that. Yesterday, Chris was invited to a call with the Center for Disease Control called Good Rural Thinkers, and I tagged along. And one of the things that we see the CDC drew a direct line on a document that they cannot share between state offices of rural health and local public health departments. So again, that's, another example of kind of, who are your local stakeholders so that we can work on a national level to seed and encourage and bring that along. So if you want to think about it in that way, I think it would be helpful. So if you have things quick, and if not, we can move on. Yeah. Sorry.
Any comments on this one?
Crystal, I'll just add here. I'm not trying to talk, or I'm trying not to talk too much. But those kind of partners around social determinant oriented kinds of work, like partners around food access, housing, those kind of partners that address those issues and may have a rural focus. Rural LISC is a group that we've started to work with nationally. So I think as we understand more and more of what impacts health and health in rural, trying to figure out how we engage with those new partners and make it meaningful for both parties.
Love that. That's great. Thanks, Graham. Matt?
I don't have a raise hand feature because I'm the host. I just want to let everyone know too that Region D pre-meeting is all about creating new partnerships with non-traditional stakeholders that you normally wouldn't have, and that's on June 8th from 1 to 4:30 Pacific time. I believe every single person on this call probably got the invite for that, but I just wanted to give everyone a heads up on this one.
That is excellent, Matt. Thank you so much for making that connection for us. If any stakeholders do come to mind, please feel free to put them in the chat for the remainder of the meeting. In fact, any of these questions, if something does come to mind, feel free to utilize the chat function. We'll make sure to document that. Thank you all for participating in our town hall. We really appreciate it. And we will have kind of this theme of a town hall continuing throughout the year. So thank you. And with that, I will turn it over to Terrell.
Thanks, Crystal. Nice job of envisioning town halls in the first place and then conducting them and carrying them through to the regional meetings. I want to go really quick because we want to hear from our friends at the Federal Office of Rural Health Policy. We did not want to let you leave the call without some reminders and some things that are coming up. I think really just going to hit these very quick. You can see the slide, same as me. We want you to know that the Data Institute is out now. It's a great series of webinars and activities to sharpen the data skills, not just of state offices of rural health, but to stakeholders. It follows a simple, pretty format that's easy to access on demand. People can listen to the live and participate in those exercises. Chris and a team of state offices originally developed this several years ago, and it's been a while since we've been able to offer it, but it is open now. We love it when you register yourself or some of your stakeholders to improve their data capacity. So look for that. And then certainly we thank you for all of the good work that you've done with rural health clinics. And as I said before, the South Carolina office, the Colorado office, and the Michigan office coming alongside and getting those TINs to report. 45 state offices of rural health have participated in that. Shannon talked about that very articulately yesterday, but we know that that's a basis to build more funding and more and to do right with the funding that's coming out now that just feels like a lot. So we're keeping our ears and eyes peeled to that NOFO, that there'll be a webinar on Tuesday. We want you to too, and we want to be strategically aligned to help you with that and to do the TA for that. Ashley would kick me around just a little bit if I did not mention National Rural Health Day. We're very proud that you all help us grow that very far. We will be launching our effort to get a community star written up for every state in the nation. We have a unique way of taking a look at it this year, and just think about that because of the State Office of Rural Health work and engaging partners at the state, local, and national level, 68 million or so impressions on Twitter relating to the power of rural. So we're proud of that, and we can't do that without you, and we want you to just start thinking about it. We're going to start giving you some opportunities there. We do want a nomination from every state. Finally, there's a benchmarking report that helps state offices of rural health do a self-assessment on some topical activities in your office, communication of the impact of the SOAR, workforce, primary care integration, which is so crucial. And we ask you to do a survey, and then Chris does a lot of great work on kind of showing you a benchmark where you compare to other states. It's all optional. The Educational Strategy Committee identified a lot of elements. I want to say there's over 30 elements that contribute to each and every one of those activities. All are optional. They really serve as some things to say, hey, if I want to build my capacity, I could focus on this. And we plan resources around that. So we know that there's a webinar coming out along with the benchmarking report on May the 27th. So we hope that you'll do that. Check those series of webinars that are really trying to help you grow your reach and your capacity around in general on those topics that we mentioned on primary care and then in connecting to NOSORH resources. So that's very important. And the next slide, please. Another thing that's really important to us is your representation on our board of directors who shape all of the work that we do in our work. So you may know that Angie Allen retired from the Tennessee Office of Rural Health, and thank you, Rachel Sprinkle, for stepping up and taking that role. She really just signed up for it on an interim basis, but Angie's term, which Rachel is stepping into, expired in December. So it's time for us to do an election. We did do a quick call for nominations, and you all got an email from Michelle. Dawn from Georgia nominated Rachel Sprinkle to serve in that capacity again. So we ask you now to take action and make an election. First of all, I'm going to ask you to unmute yourself and see if I can get one of you to second the nomination for Rachel to serve as your regional rep on the NOSORH Board of Directors. So if I can get get a second, we can do this pretty quick.
This is Graham, I second.
Thank you, Graham. And I'll ask you to say aye if you can, but I'm really going to ask you to unmute if you have a nay for us. So I'm going to, actually, I think in this virtual world, this might not be appropriate, but I'd love to hear you say aye. If I'm going to assume silence is a yay. So all in favor, please say aye.
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 Feel the love, Rachel. Any opposed, say nay. Okay, we did our election a little socially awkward, but we got that done. So thank you, Rachel. Those are her responsibilities, and she's done a great job of stepping up, and I loved hearing your voice today. And then next slide, and we'll turn things over. Before we do that, I do want to say, Matt, we should give a little extra time since we got a little bit of a late start. So I'm taking up FORHP's time right now. And I have to say that if you don't already know, we're funded about 60% of our funds from the Federal Office of Rural Health Policy. They support our work to bringing together regionally and in many other ways, resources, benchmarking reports, webinars, all of that. This year we got a new project officer, Sarah, and it's been wonderful to work with her, and she's had such a fast uptake and got me a little bit more organized for our weekly calls, and we appreciate ORHP, and certainly we're happy to have Suzanne join. It's been a little bit of a new team for all of us, and it's gone so well, and we do appreciate that we truly are a cooperative agreement of what the work should be to be done. They're sharing this time with us. So I'll turn things over now to Suzanne, I think, and thanks to all of you for all you do.
Yeah, and I'll say too, Suzanne,
go ahead, Matt.
You still get 15 minutes. You still get 15 minutes.
Well, look, I might not even need it, so we'll just see how things go. That's a-okay. Well, first, congratulations to Rachel. Love the headshot. You looked absolutely gorgeous in that. Big congratulations to you. So thank you to Terrell and Crystal as well for that awesome discussion facilitation there and those great reminders at the end. So I am really happy to be here today. I have had the great pleasure of meeting most of you at this point, but to echo everybody's sentiment at this point, I am really, really looking forward to the days in the future when these can be in person and I get to meet each of you in real life. So I am excited to continue the discussion and also to provide just a couple updates from FORHP that I've got for you. I am joined today, you might have seen, by our Deputy Director, who I'm sure you all know and love, Rachel Moscato. And I also believe that our Director, Christy Martinson, is also on the call, who you also know and love, I'm sure. So we're going to kind of collectively kickstart the discussion portion here, or they might just be supporting me through it. So first, with that discussion, I want to focus the conversation now on connecting with FORHP grantees. So Matt, if you will switch to the next slide for me. Okay, so one of the key roles that SOARs play is in helping to facilitate community knowledge about FORHP grants. And the way that that current process of information sharing works is first through FORHP communication to SOARs about community targeted funding. So we make a practice of sending direct FORHP announcements, and then there are also weekly FORHP announcements that always have updates on all funding. And if I'll just, as an aside, if you're not receiving those weekly FORHP announcements, feel free to let me know in the chat box and I can get you connected to get on that list to receive those, because those would really be helpful. So then from there, SOARs are able to disseminate that information, the NOFOs, or any other announcements about those funding opportunities to all stakeholders, and can target that promotion to specific communities where those funding opportunities might be most relevant. So information distribution, as we know, is one of the charges of SOARs, but also this process of information sharing can really help to widen the networks and relationships with new relationships, or building upon existing relationships, and the collaborative efforts of SOARs as well within different communities. Next slide. So I have two questions here that I am really curious about. So firstly, what other things do you do in your state to connect with FORHP grantees? Do you have any successful relationship building, fostering connections that have occurred in your state to share? Secondly, what suggestions should FORHP consider to assist you in making those connections? So I will let anyone, if you want to unmute yourselves, you're welcome to. You can raise your hands and I will try to see you if I can. And then alternatively, you're also more than welcome in the chat box. Anything that comes to mind with these two questions. Oh, there's Terrell.
I'm sorry.
Okay, Terrell, sorry. I saw your actual hands raised.
I just heard an interview last night about on NPR about how the interviewer is very comfortable with the silence, and that's a key skill for eliciting feedback. So good for you, Suzanne. But it makes me crazy.
I'm very comfortable with silence. Yep.
You all are, I think it's so, it's such a key question for the Federal Office of Rural Health Policy to put you very diplomatically in that, you do have a responsibility for information dissemination. And, there were days way back then that the Federal Office of Rural Health Policy used to use us kind of like eyes and ears in the state offices if there was a problem with the grantee. Now, thankfully, there's a great technical assistance center and there's lots of other resources for that. But I do think I have heard so many state offices talk about when a community grantee of FORHP is awarded, or even with the RCORE grants. I think I've heard folks talk about, oh my gosh, since we learned about RCORE, I have a whole new game and playing field for rural stakeholders I never had before. So, we're curious. I think there's so much to learn from them and from us. It's, it's a two-way thing. And hopefully, do even know your network and outreach and RCORE and other grantees in your state? What's been success? What's been a connection for you? Sorry, Suzanne, I didn't mean to jump in on you.
Don't apologize. No, this is great. Let's co-facilitate this. I love it. It's a good question.
I didn't raise my hand, but
we were in person. Oh, go ahead.
Sorry.
Nope, go ahead.
So in Alabama, we had some key retirements happen at the beginning of COVID, and when we did, we lost a lot of our contact lists. Since then, we have worked hard to try to get some contacts outside of our flex and our SHIP hospitals, because we do have strong contacts there. But with the Rural Health Clinic Project, Shannon Chambers has done a phenomenal job with helping us connect with some of the rural health clinics that have changed employees within their organizations to be able to get us good contacts there. But I think another thing is, I'm not exactly sure what we're missing. So if there are some grantees in the state, I know Alabama participates in the Delta project, and we are connected with those hospitals, but outside of the traditional SHIP, Flex, SOAR, and for our office, the PCO grant, we may be missing some that we just don't know about. So I'll be anxious to hear what's discussed. But again, thanks, Shannon.
Yeah, thanks to Shannon, and thank you too, Carl, for sharing that. Let me put you on the spot for a second. how would be most helpful to get that information to you, do you think? Because it's very possible that there are other SORHs that maybe have a similar sentiment, or in the future, there is the changing of the guards, with different states at times. And it's helpful to know how we can better assist you in knowing who those contacts could be.
Either pointing us in the direction of where they're listed, what grants are out there, or providing us with just that information. Outside of that, obviously that's the way that we would be able to find out. So I don't know any other good way to answer that, but other than just saying, tell us.
Got to keep it simple, right? That's good. All right, if there are no others, I'm going to keep it moving. And I just really welcome you, if anything comes to mind, to put it in the chat, because this really, especially how we can better assist, is truly really important to FORHP. Okay, so next slide. All right, so now moving on to just some updates and information. And, again, as I go along here, if you have questions at all that come up, please feel free to type them in the chat. I'm going to be on here all day long as well as tomorrow. So I'll be accessible to answer any of those questions that you might have. So first I want to talk about the Office of Advancement of Telehealth. Some of you may remember this. There was a Federal Register notice in January that announced that HHS is elevating the role of OAT to be moved from within FORHP to the agency level within HRSA. So OAT had already been working to coordinate telehealth activities across the agency for the past several years. And since the pandemic, they've been leading the telehealth efforts for HHS through the telehealth.hhs.gov website coordination, among other cross-federal department efforts. So just so everyone's aware, this transition was paused, awaiting the appointment of a new administrator within HRSA. So that said, telehealth efforts at this point really cross urban and rural, and now and in the future, OAT is going to continue to maintain the rural emphasis of their programming and their policy efforts. Next slide. So with that, HRSA is looking to the future of telehealth. 2020 has shown us many things. One of those is that telehealth is here and it is not going anywhere. It really can provide significant benefits. It's played a key role this past year in reducing the disruption of healthcare services. And at this point too, it's been adopted across a range of specialties. So HRSA believes that it is going to continue to grow, and HRSA will continue to be a leader in the field of telework. HRSA's vision is to continue to work across HHS to leverage telehealth activities in order to advance the field of telehealth. So we're going to continue to work across HHS with CMS, NIH, CDC, other departments, to include FCC, USDA, in order to link across programs and leverage those activities. Next slide. All right, next up, we have what I have been told is the always loved and highly anticipated slide of forecasted funding cycles for the CBD grants. So as you can see here, have a wide variety of community-based division grants and those forecasted funding cycles. The Rural Health Network Development Program grants are a 1 year, and they are awarded every year. All of the other grants are awarded on a 4-year cycle. So as SOAR, some of you may already be doing this, but onward into the future, if you're not already, you can work with communities in need to help them to figure out upcoming funding opportunities that they can start preparing for. I'm going to let that hold for just a second. And next slide. So over the next 3 slides, I just wanted to provide a few examples of some existing projects within the community-based division that are happening in Region B. What's really, really incredible about CBD, RSID, and the other community-focused programs is that there is a lot of flexibility in how the community can meet their specific needs. The programming is really very community-driven, and it allows communities to determine the best ways to address their needs and what community partners might be necessary to make change actually happen. So This first example is from the Rural Health Network Development Program. It is with a telehealth network based in Tennessee, and it covers a service area of 13 counties. The primary focus is on telehealth, but as you can see, there is a specific focus on clinical care and preventative services for individuals and families affected by obesity and related chronic diseases and behavioral health. Next slide. Another example from CBD within the network planning program is this project here that's located in West Liberty, Kentucky, working with the Kentucky Rural Quality Improvement Initiative with the goal of helping RHCs to more fully participate in value-based care programs with Medicaid managed care organizations through technical assistance and through model training. Next slide. And last up, here's an example coming from South Carolina with the CBD Rural HIV/AIDS Planning Program. So this is with Care South Carolina, Inc., which is a regional opioids and behavioral health provider who sought to form an integrated rural HIV health network that will address community HIV needs, gaps, challenges, to include issues related to the need for early HIV diagnosis and HIV prevention. So, as you can see here, just wanted to give a couple examples of projects that are happening right now in Region B, just to show you the flexibility of those community-based programs. The focus areas can really be very specific to target the community's needs and can be a really great collaborative opportunity to expand existing SOAR networks. Next slide. Okay, over the next 3 slides, I just wanted to make you aware of a few resources at your disposal in case you're not aware of them. So this first resource is funded as part of the FORHP Rural Community Opioids Response Programs, otherwise known as RCOR. It's a great place to find information and resources for your programs or to share with your communities and stakeholders to address substance use and opioid use disorders. And on the slide here, you can see a link that I'm also going to attempt to share to everyone right now. All right. And next slide, please. Okay. So FORHP funded 3 centers of excellence in fiscal year 2020 to focus on 3 different areas on opioid and other substance use disorders. So if you're interested in learning more about any 3 of these, then you can click the hyperlinks here that are provided in the slides, and that's going to take you directly to the web pages. And also, I think I've shared this with you as well in the chat. And next slide. All right, so then last up for resources, just for your information, there is a link here for the Rural Community Toolbox, and this is coming from the Office of the National Drug Control Policy. So it is an interactive online tool that can provide some relevant resources to rural, as well as some funding opportunities to aid rural communities to address substance use disorder and the opioid epidemic as well. And again, in the chat, I have got that link for you as well. And last slide, please. All right. Last thing I want to touch on is the American Rescue Plan. So May 4th, HHS announced new funding thanks to the American Rescue Plan to combat COVID-19 across the country, as at this point we all know, and we also were able to hear some more information about it yesterday if you were here for the pre-meeting. So rural clinics and hospitals will receive nearly $1 billion to strengthen COVID-19 response efforts and increase vaccinations in rural communities. And approximately $250 million is going to be rewarded to develop and support a community-based workforce who will serve as trusted voices sharing information about vaccines, work to increase COVID-19 vaccine confidence, and to address any barriers to vaccination for individuals living in vulnerable and medically underserved communities. So on this slide, I have got hyperlinks, which I think I also might be able to get into the chat box as well, just for ease of use here. These hyperlinks and the links that I'm going to put in the chat will take you to the press releases or the websites just with some more additional information. And at this point, this is really all the information that we have right now as well. As far as testing and mitigation, The rural health clinic funding for testing and mitigation will be distributed through the provider relief fund mechanisms, just like the last round of testing funds for RHCs. And the small rural hospital funding will be distributed through the SHIP grantees, similar to the CARES Act. More details are going to be coming on that soon, though. And then for vaccine confidence funds, the first round of applications for the community-based workforce funding were due yesterday, May 18th. And the notice of funding opportunity for the $100 million for rural health clinics is going to be released sometime soon. Special note on that, all eligible RHC applicants will receive funding. And let me get those links in the chat for you as well. With that, that's all I've got. Hopefully that wasn't too fast. I was trying to allow us a little bit of time for a break because I know that's necessary after about 50 minutes to an hour, I think they say. So if you have any additional questions, please feel free to drop those in the chat for me. Like I said, I'm going to be here all afternoon and tomorrow as well, so I can kind of have conversation as we're going along here. Or feel free to email me as well if you have any questions that come up as weeks pass based off of things that we've talked about today. And with that, I'll pass it back over to Matt.
All right. Well, thank you very much, Suzanne. And I'm gonna get back control of my computer, and here we go. All right. Ran a little bit over, but I think if you guys are all right with it for our break, we'll just come back right at the top of the hour. So come back here at 3 p.m. Eastern, and we'll pick up with state sharing. So have a good break, stretch your legs, get something to drink, have a snack, pet your dog, but I'll see you guys back here in 18 minutes right at the top of the hour.